Well, thank you, Renee, for that very nice introduction. So as Renee said, my name is Alexandra. I am a board-certified art therapist. I'm also a licensed professional counselor, and currently I serve as the Director of Creative Arts Therapies at CNNH. So tonight I'm going to be talking about art therapy for autism spectrum disorder. Okay, so just to kind of give you a brief overview of what I'm going to be talking about tonight, I'm going to go through a little bit on my background and personal philosophy in practicing art therapy. I'm going to talk a little bit about the creative arts therapies in general. At CNNH, we offer a pretty wide variety of different creative arts therapies, and I'll go into that a little bit. I'm obviously going to talk about art therapy specifically, and then going into a little bit more detail about autism spectrum disorder and how we use art therapy to treat some of the different psychosocial and emotional concerns that might come up with an autism diagnosis. I'm also going to address a few misconceptions. There are many for my field, so I want to just go through that a little bit. And then I'm going to also provide you with some resources and leave a little time for question and answer. I do have a number of different resources out at the desk when you walked in, so feel free to take those. I'll stick around for a little bit after as well to answer any questions one-on-one if anyone has any. Before I get into anything, can anyone here let me know just if you're a teacher, can you raise your hand? Okay, and if you're a parent or a caregiver, loved one? Okay, awesome, thank you. Okay, so like I said, I'm a board-certified art therapist, so I do have my bachelor's in psychology and master's in art therapy and counseling. I have a little bit of training from a variety of different places. I have worked in schools as well as outpatient settings, inpatient, psychiatric hospitals. The bulk of my background is in working with children and teens, although I'm going to cover more of the lifespan tonight as well. At CNNH, I do see individuals, as young as 3 all the way up through older adults. So we see everyone there. In terms of populations, I have worked mostly at CNNH with individuals with developmental delays on autism, although we also do treat other different disorders, mood and anxiety concerns, things of that nature. So I'll talk a little bit about that as well. I included this quote from a very well-known and respected art therapist. I don't know if anyone's familiar with Kathy Malchiotti's work, but she says, "The interweaving of the arts and healing is hardly a new concept, and it seems clear that this pairing is as old as human society itself, having occurred throughout history and across cultures." I wanted to include that just to kind of zoom out a little bit, because when we think of some of the roots of art therapy that I'm going to talk about, we're really talking about using art as a vehicle for communication and expression. So if we think back to the earliest people that ever existed, even then they were using the arts to communicate, interact, engage with each other. So that's really the foundation of art therapy, is that humans are naturally creative, humans are naturally equipped to use the arts to communicate and interact, and that's really the foundation and basis of the entire field. So I wanted to talk a little bit about just some of my own personal philosophies and ways of approaching art therapy. So every human being has the capability to be creative and make art. A lot of times I get questions about, do I need to be artistic? Do I need to be a talented artist? And the answer is absolutely not. If you're able to, work with materials, if you're able to tolerate the idea of engaging with art making, you're an appropriate candidate for art therapy. Anyone that, can interact with someone else can make art. Even if you can't interact, that's something that sometimes we might develop or work on together. How can we interact around the art making experience? Art is a universal language that can serve as a catalyst for growth and create a safe space. So when we're talking about art therapy in particular, and I'm going to get into this in a little bit, but one of the potential benefits or one of the uses of the art making is, of course, for that communication. So we don't rely on verbal language within art therapy to communicate, and that often serves as a really good platform for initially building that therapeutic rapport. I also take a more holistic approach to wellness. So I know that while understanding someone's diagnoses are important, and certainly having those diagnoses can be very important, I'm not looking at just the diagnosis. I'm looking at who is this person, who are they to their family members, their friends, what kind of ideas do they have about themselves, and what needs do they want to explore within our sessions. So I'm really looking at the whole person. I also try to focus on a strengths-based conceptualization. So again, while it's important to know what's going wrong or know what areas maybe of concern there are, I want to also know what's going right and how can we sort of emphasize and encourage some of those strengths that are already there. Also, I practice informed by other evidence-based practices, so a lot of the work that I do might be what I call CBT or trauma-informed art therapy. Of course, we also apply a lot of principles from ABA as well, which is applied behavior analysis. Okay, so what are creative arts therapies? I bolded the first three. Those are the ones that we have available at CNNH. It's very unique to have three modalities represented in one facility. So I wanted to just emphasize that we do have that variety, which offers a lot of choice and a lot of opportunity for individuals to not only find what fits their needs best, but also to really work with their therapist in the most comfortable and engaging way that they might naturally connect with. So the creative arts therapies, when I use that term, I'm talking about not only art therapy, which is focusing on the visual arts, but also music therapy and dance movement therapy as well. There are other two somewhat lesser known modalities within the creative arts therapy, which would be drama therapy, also known as psychodrama, and then poetry therapy. So this is the definition that the American Art Therapy Association identifies. So art therapy is a mental health profession in which clients, facilitated by the art therapist, use art media, the creative process, and the resulting artwork to explore their feelings, reconcile emotional conflicts, foster self-awareness, manage behavior and addictions, develop social skills, improve reality orientation, reduce anxiety, and increase self-esteem. So it covers a lot of areas. This is a somewhat broad definition, but I wanted to include it to just highlight the range and scope where you might find art therapists practicing in terms of the different areas of concern. A goal in art therapy is to improve or restore a client's functioning and his or her sense of personal well-being. Art therapy practice requires knowledge of visual art, so that might include drawing, painting, sculpture, and other art forms, and the creative process, as well as knowledge of human development, psychological, and counseling theories and techniques. Honoring individuals' values and beliefs, art therapists work with people who are challenged with medical and mental health problems, as well as individuals seeking emotional, creative, and spiritual growth. So just going back a little bit on the background, art therapy has been a profession since about the 1940s. The American Association of Art Therapists was founded in 1969, and then the Art Therapy Credentials Board, the ATCB, was founded in 1993. It is an internationally recognized form of therapy as well, so you can find art therapists working all over the world. Compared to other fields within mental health, it certainly is a younger profession, and that's why the Art Therapy Credentials Board has played such an instrumental role in trying to establish some of the standards and ethical practices. And I'm going to talk a little bit about that as well when you're looking for an art therapist, what types of things you want to be asking about and what types of credentials you do want to look for. So art therapy can take a lot of different forms. Certainly at CNNH, we offer individual as well as group sessions. But there's also something called community art therapy, which is something that you often hear about in the news when they're talking about art therapy, things that are more community-based rather than individualized. Each session might be as unique as the individuals participating. So every session can look very different. The materials used may be very different. And it can also be very different just depending upon the person that's participating. Some individuals may feel more comfortable with a certain level of verbal interaction, others may not. Sometimes it might involve active art making, and other times it might involve more reflection or more interaction. So it really just depends on those treatment goals that the individual might have and also how that art therapist in particular may practice. The session is led by the natural interests of the participant as well as their needs. So an art therapist is going to be holding sort of those two pieces in their mind when they're conceptualizing how they're going to structure the session. It also relies on pre-verbal processes, which makes it accessible to nearly every client across many levels of functioning. So again, we may incorporate verbal interaction, but it's not a requirement in order to gain benefit from the session. Okay, so art therapy itself comes out of really three separate disciplines merging together. So through art education, we're thinking about the stages of artistic development or the developmental level shown in imagery. And that's from Lowenfeld, who identifies several different stages of development that every human being passes through across cultures. It also incorporates, of course, visual art, so looking at nonverbal communication and expression, materials and media, the aesthetics and color theory, and then also looking at the field of psychology, so pulling from different counseling theories, when we're talking about symbolic meaning, imagery, dream analysis, some Jungian ideas, also, of course, diagnosing pathology systematically, and then incorporating some level of psychosexual stages of development in terms of the overall conceptualization for a case. So it's really pulling from these three different areas, and art therapists really have to have knowledge across all three areas specifically. So I wanted to include this graphic here. This is courtesy of Kathy Malchiodi and Josh Kale. So this explains a little bit of sort of the two tracks of art therapy that an individual might encounter. So art therapy falls into these categories known as art as therapy and art psychotherapy. They can, depending on the situation, be used together, but you might often find one or the other. So when we're talking about art as therapy, that's when we're referring to when art-making activities are used as the therapeutic tool toward the process of healing, expressing oneself, and reducing stress. So this is where there's intrinsic value to the art making itself. So rather than focusing on, which I'm going to go into the next component, art psychotherapy, more of those unconscious processes underlying it, we're really utilizing the art as a tool in the session. So then for art psychotherapy, that's defined as a form of expressive therapy based on the idea that art is a vehicle for symbolic communication. So I'll give you an example. Within someone practicing under art as therapy, we may find that an individual, may be seeking an outlet for expression and perhaps offering them materials that are comfortable or familiar to them. Just having that mere expression can be therapeutic, and that has value. Within art psychotherapy, if we're taking a different approach or a different look, we might be thinking a bit more, what does the actual content mean to that person? So if they create an image of a volcano exploding, what might that symbolize for them personally, and what can we explore through that to help them understand more about themselves or about their needs? So really we're talking about these two kind of separate tracks, but again, they can be utilized together when appropriate. Okay, so who are art therapists? So a master's degree is considered the entry level for the field. The credential of the board certification is the highest level credential, and you need to pass a national exam demonstrating comprehensive knowledge of the theories and clinical skills used in art therapy to receive that. It also requires postmasters, 1,000 clinical contact hours and 100 supervision hours, and that must come after an ADA-approved graduate program. The clinical coursework includes psychopathology, clinical diagnoses, human development, research methodologies, art psychotherapy, family art therapy, multicultural counseling and competencies, group dynamics, clinical appraisal and assessment, etc. The coursework and practica typically occurs simultaneously with a thesis in the final year. And then programs may vary in terms of theoretical orientation, but many are rooted in more psychodynamic or psychoanalytic theories at their base. Most art therapists that you encounter will utilize more of an eclectic approach. I wanted to include this because when I talk a little bit about what you're going to be looking for if you're seeking art therapy services, it's important to understand what credentials you're really wanting to have in that person, and I'll go into a little bit of explaining that in a bit. So where do art therapists work? You might find us certainly inpatient hospitals, intensive outpatient or partial care programs, outpatient facilities, nursing homes and senior communities, day programs, veterans programs, schools, rehab programs, forensic institutions, and also, of course, in private practice. So who can benefit from art therapy? Art therapists do work with a variety of individuals, and they may have a specialty area or perhaps work in a facility that has a particular specialty. But in general, art therapists can work with individuals with the following diagnoses. So mood disorders, anxiety disorders, selective mutism, trauma-based disorders, developmental delays in autism, ADHD, oppositional defiant disorder, eating disorders, traumatic brain injury, Parkinson's, and then dementia or Alzheimer's or other cognitive decline issues. So all ages, races, ethnic and cultural backgrounds, all individuals can benefit from art therapy. Really, it depends on the individual if it's going to be a right fit for them. Groups, individuals, families, couples, communities, certainly developmental, medical, social, physical, cognitive impairments, truly any individual that's seeking personal growth or development, and then a range of functioning levels. One of the reasons why art therapy is really well suited to such a variety of needs is because it's adaptable to the individual's, not only their interests, but also, again, what their specific needs are. So a lot of the interventions that we might use, we can adjust for a variety of different functioning levels, and we're trained to be able to not only assess what those needs are, but also then implement strategies for being able to adapt to that. Okay, so I wanted to just talk about what I'm referencing when I'm referring to autism. Certainly with the development of the DSM-5 in 2013, there was a lot of, I think, confusion and concern about the changing criteria. So I wanted to just clarify when I'm referring to autism what I'm actually referencing. So I'm going to talk just a little bit about autism itself, and then I'm going to go into the other diagnosis that we commonly see, which is the social pragmatic communication disorder. So in the past, of course, we would think of the term high functioning autism. And so that's what I'm going to be talking about for the bulk of the presentation today. Although I want to clarify that certainly art therapy can be appropriate for a range of challenges within an autism diagnosis, mild all the way through to severe. So when we're talking about autism, we're talking about persistent deficits in social communication and social interaction across multiple contexts as manifested by the following currently or by history. So we're talking about deficits in social emotional reciprocity. For example, abnormal social approach and failure of normal back and forth conversation to reduce sharing of interests, emotions, or affect, failure to initiate or respond to social interactions. Also deficits in nonverbal communication behaviors that are typically used for social interaction. For example, poorly integrated verbal and nonverbal communication, poor eye contact, difficulties with body language or understanding the use of gestures, to a total lack of facial expressions and nonverbal communication. There's also deficits in developing, maintaining, and understanding relationships. For example, difficulties adjusting behavior to suit various social contexts, difficulties in sharing imaginative play or in making friends, or the absence of interest in peers. So then we're also talking about restricted repetitive patterns of behaviors, interests, or activities. So we may see stereotypies or repetitive motor movements, lining up of toys, echolalia, idiosyncratic phrases, insistence on sameness or inflexible adherence to routines, ritualized patterns or nonverbal behavior. Other common areas, difficulties with transitions, rigid thinking patterns, difficulties with greeting rituals, need to take the same route or eat the same food every day, for example. And then the highly restricted or fixated interests that are abnormal intensity or focus. Sometimes we might refer to these as narrow interests. And then either hyper or hypo reactivity to sensory input or unusual interest in sensory aspects of the environment. So apparent indifference to pain or temperature, adverse response to specific sounds or textures, and excessive smelling or touching of objects, visual fascination with lights or movement. So these are just some of the criteria that needs to be met in order to meet the criteria for an autism diagnosis. The symptoms must also be present in the early developmental period. They must cause clinically significant impairment in social, occupational, or other important areas of functioning. And they're not better explained by an intellectual disability or global developmental delay. The important note, of course, is that intellectual disabilities and autism can co-occur, and to make that comorbid diagnosis, the social communication needs to be below what's expected for the general developmental level. So this is what we're talking about when we're using the term autism. So this is a component I just wanted to highlight as well. So in terms of course, the new standard for identifying the severity level, art therapists can work with all levels. I'm going to focus on the needs specifically for the higher functioning individuals or individuals that are maybe what would be considered now a level 1, requiring the least amount of support. But of course, art therapy can be appropriate for the range. Okay, and then for social pragmatic communication disorder, so this is another disorder that some individuals who perhaps if they were tested, previously and the older standards for the DSM were still applicable, they may have received a diagnosis of Asperger's or again that term high functioning autism. But so I wanted to include this because that's what we're going to be focusing on today as well. So in terms of social pragmatic communication disorder, we're talking about persistent difficulties in social use of verbal and nonverbal communication. We're also talking about deficits that result in functional limitations in terms of that communication, social participation in relationships, academic achievement, or occupational performance. Again, the onset needs to be in early development. And of course, the symptoms need to not be better explained by another medical or neurological condition, such as autism or intellectual disabilities or global developmental delay. Okay, so I'm going to talk a little bit now about art therapy specifically and why it's often a very good fit for individuals with autism. So the first point, process versus product. So one of the common misconceptions about art therapy is that we're helping individuals to perhaps be better with certain artistic abilities or creating certain products that might be very pleasing aesthetically. And while that can happen and can be a natural result of over the course of a session, we're really not focused on that product. We're focused on the process that unfolds of either initiating, engaging, creating that art material or media, and having a successful experience with it. So it's success-oriented. So we're not, incorporating tasks or introducing tasks that are wildly outside of the scope of the individual's abilities. We really want to build up their strengths, but also meet them where they're at. So if there needs to be, some level of introduction to materials or exposure to them, certainly that may be a part of the process. If an individual, prefers certain media, that certainly may be a part of the process. So we're really trying to incorporate how can we create the appropriate challenge level for this individual to move them through to their goals and achieving those goals while also respecting where they're at in that process. So we're really focusing on their inherent strengths. So I have some individuals that I might work with who some of their strengths really might be in more 2D media, and so I may incorporate that. I have others who maybe that's a somewhat of a trigger point for them emotionally, or might be something that really challenges their frustration tolerance, and so that may be an aspect that we incorporate into sessions to help build that. So art therapy also provides opportunities for interaction and connection. So even in individual sessions, of course, the therapist is working with the individual one-on-one, and that can be a social opportunity. But we also offer the group options, which again provide opportunities for interacting with same-age peers or peers that might be challenged with the same difficulties. And so sometimes that can be a nice fit for individuals that do have an autism diagnosis that are really looking for that social interaction or just those social opportunities. So it provides an opportunity for that around the shared experience of art making. So I have encountered a lot of individuals who have maybe pursued art therapy services and saying, maybe I have an interest in art making, but a typical art class is just not feasible for me or my child. Maybe there's an avenue that they like to explore, but there's some anxiety or fear about exploring that in other venues. And so that can be another nice aspect as well, is that it provides really this very unique opportunity to safely explore that. It can contribute to a sense of belonging and community. So again, for individuals that maybe are looking for more of those peer supports or wanting that peer interaction, it can really provide that and set the tone for that. Again, the shared experience of art making can create that safety where maybe in other social groups, the reliance might be on more verbal interaction or an expectation to have a certain level of verbal skills. And the art therapy simply doesn't require that and allows any individual of any ability to come in and interact. It also can be tailored to individual needs, preferences, and areas for growth. So as I mentioned before, we're thinking about not only the individual preferences around certain art materials, but also what are their needs. So for example, if an individual can tolerate more structured media like pencil or crayons, but perhaps as soon as it moves towards something a little bit looser like painting, a lot of anxiety may happen. For some individuals, that might lead to some regression. So we're going to be working with that individual to not only build up their strategies for coping with whatever they may be experiencing, with those looser media, but also how can we help them be successful in other experiences like school, where they might encounter that as well. And then also it can be very non-threatening and familiar. So for the majority of people coming through, they have some level of exposure to art media, again, either in school or in other settings. And so we can create that safety in that it's not something very novel or new to individuals coming in. It's non-threatening in that, entering into perhaps like a typical counseling relationship, sometimes there are a lot of fears around what that looks like, or just again, the need to have a purely verbal interaction. And so incorporating the art media levels the playing field where, we can really make it work for anyone and any need. The verbal language is certainly not necessarily required, but it also encourages both verbal and nonverbal communication skills. So for example, if an individual has one of their goals as maybe being able to use more verbal language, we may create a piece of artwork, whatever form that might take, and then I might encourage that individual to give it a title, to label it. I might ask them to describe it if they have those capabilities. And so again, while that's not a required component, the verbal interaction, it often is very helpful and can help build those areas if necessary. And then again, for individuals that have higher verbal skills or typical verbal skills, that's really where we might spend a lot of time within the session, is processing, what that experience was like, being able to depict, things going on in that person's life or their day through the imagery. Another benefit is that we can work on sensory exposure and tolerance building. So, obviously we have access to a wide variety of media. And if an individual does have either sensory aversions or even certain perseverations on different sensory experiences, that may be a focus of the work. So we may incorporate those aspects to try to help build that tolerance to those experiences. And another aspect as well, we might work with the individual to try to have appropriate interactions with media. So for example, if an individual maybe doesn't know how to utilize, for example, maybe painting, just as an example that might happen in a school day, we might work with that individual to really identify how are we going to, appropriately utilize the paint in this session. How can we work in a group session, for example, if there's very stimulating materials such as water cups or other materials, how can we work with those to more appropriately interact with them? The artwork can also be a tangible tool for marking change and progress in therapy. So I'm going to go into this in a little bit, but we do have a number of different drawing assessments that we may use to really ascertain the level of functioning, but also, again, what those clinical need areas are. And we can use those assessments at different intervals throughout the treatment to see if there's any change and to mark that change. And then in addition to those specific assessments, we of course have art making that typically is taking place at every session. So we can often identify different areas. For example, if an individual is showing regression, if an individual is showing a much better response to the structure of the session. So there's all sorts of different areas we might be looking at to really assess and mark that change. And this can be very helpful for caregivers and families, as well as individuals themselves, because they can really look back at the total course of the artwork and say, wow, when I first started, I was really hesitant to, make any marks on the page, and by the end of the work, I really felt more comfortable with that. And now I'm seeing that show up in other parts of my life, where I'm able to initiate, perhaps, for example, interactions more, or try novel experiences now. Okay, so I'm just going to pull up a quick video clip that I wanted to include that highlights some of the areas that I was just mentioning in terms of the benefits.
I I love the metaphor of art making. I love the experience creating a space that people can either through the process or through the product really explore their lives.
Maya is an art therapist at Easterseals Therapeutic School and says that for people on the autism spectrum, art therapy can help manage some of the social and communication challenges associated with the disorder.
3 of the major benefits that I get a chance to see daily are students making steps in independence, making choices around color, using materials appropriate, and kind of mastering different materials all assist in their mastery of independent skills that can hopefully be translated. Students that are unable to use words to express themselves, again, it can be a major tool for them to communicate their life experience. And then social, having some of the students come into a group, meeting and working with peers and sharing those experiences. It provides a great space to practice some of those really challenging nuances of working with people in a community or at home.
Maya works with students in group and individual settings, tailoring each session to fit her students' needs.
I've gotten to know Manny over a year. I think one of the major things that we've worked on and one of the major strengths of our experience together really has been seeing pluses and hopefully that empowerment to talk about his life.
Let's go everything what I have inside. I feel like I'm like a different person because I'm part of art, I'm part of something.
The detail he might not always be able to communicate with words, but with an art making, it is you see it instantly when you look at it, the detail and the nuances of his work.
Manny says he's changed since learning to express himself through art.
I don't get frustrated a lot, I don't talk back a lot. I used to talk back a lot, I used to get in trouble going to school.
Art therapy can be a space to work through some of those issues and challenges and how they relate to life.
Patrick is another one of Maya's students who learned how to communicate with others, thanks in part to art therapy.
In working alongside a speech therapist, we've been able to communicate using words as well as art images. And so using succinct phrases, short sentences to explain where Patrick's point of view is coming from, being able to talk about his life and connect with others.
I be creative, I be myself. I'm not pretending to be someone I'm not. And I create things how I feel.
Arts helped Patrick connect with family members in new ways. He says the piece he's most proud of is one that helped him share feelings he'd always felt, but rarely communicated.
The Veterans Day thing for my grandfather, he was my hero when I was young because of 2 wars he's been. I never tell him that he's like really is my hero. It felt good. I'm doing it for a good reason.
Just like Patrick and Manny work to understand themselves and their talents, they say it's important for other people to work to understand autism.
If you don't understand it, try to understand. If not, don't. If you do understand it, I'm okay with it.
People should make fun of people who have that stuff and stuff like that. Just be all the same.
For more information on autism and art therapy, head to our website, livinghealthytv.com.
Okay. Okay, so in that clip you could really see, they did a nice job of highlighting some of those areas that we've been touching upon, but also you can see from the individuals themselves, they may find benefit in it as well. So they can recognize that some of those areas that maybe they were previously struggling with can really progress through the course of a group session. So some of those goal areas that art therapy can address, and this again, a lot of these areas I'm specifically talking about autism, but really can be applicable to a wide variety of diagnoses and concerns. So developing those communication and language skills, you could hear even just in that video clip, those individuals were creating external products, but then really utilizing those as vehicles for communication, not only with each other, but also with their peers. And again, the language is not required, but it does provide that opportunity for using language. It also helps build confidence and self-worth. So when you've created a tangible product, when you've been able to be successful with, having an idea in your mind and bringing it out of your mind into reality, you can really develop that sense of self-confidence where, in other areas of your life, you might not be as successful or able to do that as easily. It provides the opportunity for social skills, but also can specifically build social skills. So in some of the group therapies that we offer, we may target specific social skill needs. So we may be doing more of a curriculum-based, utilizing the arts as part of that process and over the course of that group cycle. Provides opportunities for self-regulation. So there are a number of times where an individual may start art therapy, and in the beginning, really the only goal is just to have that self-regulation through the session. So we may be utilizing, again, preferred media or materials, sometimes very little media, something that might be as simple as just tolerating being in the space of the room itself. So really working to build those self-regulation skills. For some individuals also who find certain art media very soothing, we may not only encourage that and utilize that, but that can then become a tool that gets used either in home, school, or work settings also. So I have some individuals, just as an example, one patient I'm currently working with finds using putty, a very clean putty material, very soothing. So that person had discovered that in art therapy and now utilizes that as a transition tool in school, going in between classes, sometimes even on their breaks. They may utilize that as an appropriate means of expressing themselves. So really, not only the media itself, but then what we're doing with that media is important. Then that leads into the next component, which is developing adaptive coping strategies. So not only exploring the different emotional states and helping to build awareness of different emotions, which can be a challenging component for individuals with autism, but also understanding and anticipating others' emotional experiences, being able to read those nonverbal cues, being able to attend to those nonverbal cues. And then also, of course, utilizing those skills that we're building through that awareness to have more internal and external coping tools. We're also focusing on reducing anxiety. This is probably one of the areas I work with the most just across the board, even outside of individuals who have an autism diagnosis, really trying to help them reduce the anxiety they may feel day to day. For individuals that are in the spectrum, of course, that expectation for constant social interaction and constant understanding of social nuances can often provoke anxiety through the bulk of the day. So even if nothing else, sometimes that art therapy session can be a respite for that individual, where they know no matter what they're facing that day or what challenges might be happening, that's their space to really express and modulate themselves. And then we're also focusing on improving mood and reducing irritability, which can also be components common for individuals with an autism diagnosis. Whether that's coming out of the session, shifting that mood, or it might even be just being able to tolerate that, label it, name that mood that they're experiencing. Those are all some common areas that we might address. So this is another question that I get often. How are art therapy sessions structured for an individual with autism? So again, not to sort of pigeonhole, because of course for every individual with autism is different, but there are some common themes that I might consider when working with an individual that might help provide that appropriate structure that's necessary. So when I'm thinking about the art media, I'm thinking about, again, that patient interest and motivation, their larger treatment plan and goal areas, their particular mood or stressors, other factors that might be at play on that particular day that we're having the session, relevant topics or themes. So for example, if perhaps they're working with a behavior therapist on eloping and transitions, maybe that is something that I want to pull into the art therapy session as well. Or for example, if an individual is working with an occupational therapist and they're really doing a lot of sensory exposure and sensory tolerance, that might be something I don't focus on so much, and I shift on some other relevant topics. And then of course the sensory needs or aversions, I'm considering that as well in terms of the structure. It might involve the combination of active art making as well as the verbal interaction or processing or reflection. For children, the sessions may or may not incorporate parents at times, again, just depending on what that treatment plan looks like and what those needs are. And then, of course, we collaborate with other treatment team members. So I just listed some of the common individuals and professionals that I might consult with or work with or share a case with. So at CNNH, we do have behavior therapy services as well. So often our teams work together. We do have a BCBA on staff, as well as a number of, which stands for a board certified behavior analyst, as well as registered behavior technicians. So we often collaborate to try to really, again, have that holistic picture of the person. I often do communicate with speech therapists and occupational therapists if the patient does have a neurologist as well. And then of course school counselors. So if an individual is participating in art therapy, if for example they're really developing some really appropriate coping skills for the school setting, I of course want to be able to share that with the school counselor if appropriate, so that they can have that at their disposal to use during the day as well. And then termination occurs when the goals have been met consistently. So usually I'll say, if the goal has been met across those 3 sessions, that's when maybe we need to readdress other goals, or termination might be appropriate at that point. So just in terms of the overall structure, those are just the different aspects that I'm thinking of in terms of conceptualizing, from start to finish, what that looks like. And then just to go a little bit further into the different components, so there's obviously the patient and therapist rapport. That's an important element. When I think of sort of just like if someone was sort of looking outside of the session, we're thinking about the patient, the therapist, and then the tertiary space of the artwork or art process. So those are sort of the 3 pieces that are, throughout the whole session kind of interacting, but also are separate pieces. I'm looking at not only the imagery of what's being made in the artwork, but also the content. So this is something I'm going to talk a little bit further about later, but one of the misconceptions I think for a lot of individuals when they're first hearing about art therapy or learning about it is that the art therapist is going to be in some way interpreting the artwork, and that is not necessarily true. There certainly are different aspects, what we call graphic indicators, things that might clue us into, hey, this is something maybe we need to explore, something I need to ask about, but it's really up to the individual, what the individual's meaning making of that imagery is. So I'm thinking about those components. I'm also thinking about the actual art making itself. So there's something called the Expressive Therapies Continuum, or the ETC, that was developed some time ago, that helps art therapists put a framework to these different processes, but also how they connect directly to different areas of the brain and different activity in the brain. So one of the first levels is the kinesthetic to sensory level. The second level is perceptual affective, and then the third level is cognitive and symbolic. So at any given time, an individual may be, for example, operating from one of these levels, and perhaps as part of their goals, we're trying to move them into a different level to be able to encourage the success with those goals. So for example, I have some individuals that are, maybe very intelligent and utilize a lot of words to circumvent some of the challenges they might be having. And so that would be more of like the cognitive or symbolic level. And so perhaps what I need to have them do is work more in that kinesthetic or sensory level to try to get around some of those things that they might be using in their language to avoid addressing certain issues. So that's just a very simple example, but that's sort of how that framework operates. So we're thinking about that process. And then of course also the reflection and sharing piece. So if there is, after the active art making process is complete, any kind of verbal reflections or questions that might be asked. If it's in a group setting, sharing with peers, sharing with the therapist. There's also a component of skill building and practice. So if I'm operating from a cognitive behavioral therapy informed art therapy approach, I might be really focusing on that skill building. So, for example, identifying certain cognitions or thoughts and how they may impact our behaviors. And then of course the practice that comes with that, both in between sessions and within the session itself. The last 2 there I wanted to just include because that's something that I personally use. So for a lot of individuals that do have an autism diagnosis, high structure can bring a certain level of comfort and also predictability to the sessions, and also encourage engagement. So often I'll include some level of a warm-up opportunity, and that again might look different depending on each individual. It could involve something more sensory-based. It might involve what I call a feelings check-in. So I have in my therapy space a few different types of feeling charts that either have words and or images, visual cues on there. And I might ask the individuals to just check in with themselves about how they're feeling on that particular day, on that particular moment. So those may be some examples of the warm-up that I may do. Then I also might have a specific plan for the transition. So for example, when we're transitioning between tasks, that's often a time that maybe there's some regression or some anxiety that might come up. So we may have a specific plan that we develop for when we're shifting tasks. Maybe if we keep a jar of putty on the table, they know that that's something that they can utilize while I'm setting up for the next experience. And then a cool down opportunity. So I use that phrase, cool down. Really what I'm referring to is an opportunity for closure or for ending the session. So that might involve something as simple as putting the materials away, and that's sort of signaling the end and the wrapping up. It might involve more, again, of that verbal processing or closure. And it might, again, involve a feelings check-in. How do you feel at the end of the session? So all those are different things that I tend to incorporate, again, to try to really encourage that structure. And then also homework, I don't really like to use that word, more of the action plan. So things that the individual may be doing in between sessions to help further their goal areas, whether that's practicing things that I've introduced within the session. Sometimes it might also be for the caregivers if there's more of a behavioral approach being taken. Perhaps there are any, for example, I have one individual I'm working with who uses an art journal in between sessions, and so part of their action plan, between each session is to create something in that journal expressing a feeling, an emotion, an experience they have had. So again, very simple examples, but just to give you an idea of sort of what that looks like. So common interventions. So I think, I wanted to cover kind of a broad range of different considerations when I'm thinking about the art therapy session, but one thing that doesn't get talked about, I think, enough to give clarity is really what we're doing in each session. And I know that's sort of what, a common question, like what's actually happening? What are you going to be doing in the session? So I included here first some of the common assessment tools that I might use, and each of them are very different. This is not, by any means an exhaustive list, but I wanted to include some of the common ones that I might use currently with the populations that I see now. And then I also listed a few different interventions that I might use over the course of a therapeutic relationship. So for the assessment tools, there's something called the DDS, or the Diagnostic Drawing Series. That is probably the one I use most commonly, and that involves a series of different images, each with a different directive, looking at different areas of concern. Again, the art therapist is not there to interpret the artwork, but this can be a tool for us to have an idea of what questions we may be asking or what areas to explore a little bit further. There's also the draw person and the kinetic family drawing. And again, both of these I commonly use them to assess a variety of different areas. So then the feeling charade, so this is something that I commonly do with individuals if one of their goal areas might be working towards either better emotional expression or understanding, as well as self-awareness. So this involves, and again, can be tailored to each individual, but some level of creating either on paper or through mask making, different common emotions. Sometimes we'll start with the big six. And then from there, really taking turns acting out, both with the therapist and the individual, on our own faces, what those expressions might look like. And again, the goal of this is to really help build not only attending to the nonverbal cues, so facial expressions being one of them, but also body language, but also helping those social skills. So a lot of times this may turn into a lot of laughter or a lot of joy within that. Sometimes it can be very challenging, and individuals are really struggling with this. So again, we adapt this to fit each individual person. A coping skills box is another task that I'll use pretty commonly. I should zoom out for a second and just mention that I would never introduce any of these, as sort of the first time I'm meeting an individual. These really take place over the course of working with someone as they become comfortable within the session, but also as I get to understand their needs better and who they are. So all of these different interventions I'm listing here are things that I would do over the course of a therapeutic relationship. But the coping skills box essentially is where, after identifying maybe some key coping skills that an individual may have, we may create a container or box where we store cards, and each card has a different coping skill listed. This coping skills box could be something that we keep within the sessions to use during our sessions. It could also be a tool that goes home with the individual. So if it's something where at home they're looking for, more translating of those skills to a home setting, that might be a tool we use. But this is very helpful for individuals on the spectrum as it's visual in nature, so each of the cards may have a visual cue of what that strategy is. It also allows a lot of personalization and engagement. So I may have the individual not only decide what color cards we're going to put the imagery on, but also they're responsible for designing and decorating the box itself. So they may put, again, this is a way to channel some of the perseverations or narrow interests. They may decorate the outside of the box with Minecraft characters if that's something they're really enjoying. And that is appropriate and on task. So it's, again, utilizing the strengths that are already there and allowing an opportunity to have a skill come out of that. Another common tool that I use are, I call them comic strip social skills, essentially social stories, but having the individual participate to a much greater degree than usual with the actual creation of them. So I might set the framework of the topic of the social story, or perhaps even the sequence of things that has to happen through that story, but I might encourage that individual to create the actual imagery, if that's something they enjoy and like to engage in. Art journaling, certainly, as I mentioned. So sometimes I'll have individuals create an actual journal they may utilize in our sessions itself. I might also have an art journal for at home or at school, and that can be a really helpful tool. And again, the content of what goes in that journal can be very open-ended, or it can be very structured. So if an individual needs that greater structure, I can introduce that as well. And then just in terms of more of group activities, in groups one common task I might use is a group sculpture. So I may give each individual a piece of clay. Usually if it's in a group, I try to use as highly structured media as possible because the group dynamics can lend themselves to some regression or anxiety, so I try to support that through the media. But for example, I may give a model magic or some other kind of higher structured, cleaner type of building material, have each individual create their own object, whatever that might look like, and then come together to build a group sculpture. So it's allowing for opportunities for individual expression, but then also really having to work with peers to create something together, and also tolerate all of the different social nuances that happen in that interaction. So whether that's having to ask someone, can I put my piece next to yours? Whether that's being able to tolerate someone putting a piece next to yours. The different personal space components. Should I be very close to someone, or am I paying attention to their bubble space? So all different aspects that are kind of happening at once there. So again, these are just some common interventions that I use throughout the work that I do currently that I thought would be helpful to have some clarity on. Okay, so this is, again, another sort of infographic courtesy of Josh Kale. He has a lot of wonderful different fundamentals of art therapy that he puts out that are sort of just more visual guides to the different components, and I think they do a really nice job of making it very clear. So this is an example of one particular art assessment we might use called the Draw a Person. So in terms of an overview, the Draw a Person assessment is a projective measure, so it's designed to get a better understanding of how an individual unconsciously perceives him or herself. So we're looking at everything from the facial expressions on the individual, or the presence of facial details, the body language, the line quality, the particular materials that are used. So does the individual gravitate or select very loose media, or do they gravitate towards more structured media? Is there color in the image, or is there a lack of color? Is the color representational? And also, of course, the individual's description of the drawing if they're able to give any sort of verbal input. So all of those different areas are what we're looking at through just this image of the Draw a Person. And he goes into some really nice detail about what he refers to as diagnostic indicators. I call them graphic indicators. And again, they're not to say that we're interpreting the artwork, but they're giving the therapist a clue to what questions we may ask or what areas we might need to pay attention to. One common area that I've observed just anecdotally in working with individuals on the spectrum is that sometimes when there are human figures, there may be either a lack of facial detail or expression, or it may be very exaggerated, or there might be a discrepancy between the individual's description of how that person is feeling in the image and how they actually appear. And so all of these things are different aspects that if I notice them, that may be a clue in terms of what questions I might ask that individual or their caregiver. They give some examples of what that looks like. So they give an example on the first left-hand side. You can see the individual has a very high level of detail, including the clothing. The second image, that person is missing some details in terms of, of different aspects, but they are showing, again, some high level on the face in terms of the teeth and eyes and nose. And then the last image, they're showing the lack of hands. And again, we utilize these different assessment tools or drawing assessments at different intervals throughout the course of the therapeutic relationship. And it's just another tool, sort of in my back pocket to really get a sense of where is this individual in terms of their progress, and also what needs are there that are currently presenting. Okay, so what to look for in a prospective art therapist. So certainly you want, and again, I realize that sometimes this can be an awkward conversation, but I think it's very important to know, because unfortunately there are a lot of individuals that are very well-meaning, but may say, oh yes, I utilize art therapy, in my sessions, or I am an art therapist, and unfortunately they just might not have the training or knowledge to understand that that can be very dangerous. A lot of the different media that we use, as I mentioned, can lend itself to either regression or structure. Some of the different tasks may be very anxiety-provoking. For example, the kinetic family drawing with the directive of draw you and your family doing something, that can be very provoking for individuals often. So if you simply just don't have the knowledge base or the training to know what to look out for, or know what things can be the result of that, and then what things you may want to introduce for safety, it can be dangerous. So you want to definitely look for someone who has the appropriate training and credentials. Other terms that you might look for are the ATR, which stands for Registered Art Therapist, or the HRDC, bless you, which stands for the Board Certified Art Therapist. The American Art Therapy Association does have a really nice search tool on their website, so if you're looking for a provider in your area, that's a really easy way to access that. So does the Art Therapy Credentials Board. They also have a lot of nice information on how to locate qualified art therapists. And then just general questions for consideration. So you might ask, how long have you been practicing art therapy? What are your personal philosophies or approaches to practicing art therapy? And also, of course, if an individual does have an autism diagnosis, you'd want to know their familiarity working with individuals on the spectrum. Certainly there are a lot of art therapists that do work with individuals on the spectrum, but there are many that might not have that experience, and just like anything else, that's very important. You want someone who does have that experience and knowledge base to support what the work they're going to be doing. Okay, so I'm going to talk for just a few minutes about the inaccurate use of term art therapy, because this is something I've observed pretty rampant, and so I just wanted to highlight that because I think it is important. So art therapy is an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. On occasion, non-art therapist practitioners might be found to advertise their services as art therapy. This is an inaccurate use of the term, as art therapy can only be practiced by an individual who possesses the required training, certification, and/or state licensure. Bona fide art therapy is beyond the scope of practice of non-art therapists. So I want to clarify here that this doesn't mean that other therapists or educators or other professionals can't utilize art, but I just wanted to highlight that it's very important to understand sort of all the implications that can come with different material and different interventions. And so you just want to be aware and sort of have that understanding. There also are, like I said, some individuals that may call themselves art therapists that simply don't have that background or training, so it's very important to ask about that. Another context in which art therapy may be inaccurately categorized includes professional trainings that furnish a certificate upon completion, which may mislead the participant to believe that he or she can practice art therapy. These sorts of trainings, workshops, and the like give attendees the erroneous impression that art therapy is a modality rather than a profession. So a good example, I guess, sort of tying into this is a few years ago, I don't know if anyone remembers, there was sort of all of a sudden this surge of coloring books that were labeled as art therapy or given that title. And while there's absolutely value to coloring books and having those tools, that's not art therapy. Art therapy really takes place in the context of that relationship with the therapist and also someone who has, of course, that background and training. Again, the reason I wanted to highlight this is just because I have encountered individuals who have come into art therapy saying, oh yes, I previously participated in art therapy, but then upon further probing, maybe they meant, oh, they've utilized coloring books before, or anything kind of along that spectrum. So it's really important because it also is important for the individual participating to know what that looks like or doesn't. For example, if an individual who is not an art therapist calls themselves an art therapist and engages with an individual in a certain way, they may have very negative impressions about what art therapy really is or about what to expect. They might have confusion about the boundaries of that professional relationship. So there's a lot of different areas that can get very muddled very quickly. So I just wanted to include that just to bring everyone's awareness to it. Okay, so I touched upon some of these already, but I wanted to highlight them because these are the ones I hear, I think, the most often. So the first one, art therapy, is for artists. So certainly, artists can benefit from art therapy just like anyone else, but it's not a therapy geared towards artists only. Art therapy is facilitated by artists. So certainly art therapists do need to have a pretty broad base of knowledge about art media, art education, certainly, like I said, different psychological theories and counseling. But the art therapists may or may not be artists themselves. That really is dependent upon the individual. The next one, art therapy, is the same as play therapy. So this one is one that comes up pretty often as well. So while art therapists may utilize aspects of play therapy, for example, sometimes I'll have individuals create figures or dolls or different objects, and we may utilize them as part of a role play or part of an experience. It's a very different field than play therapy. Play therapy is a wonderful type of therapy, but is just different than art therapy and has different training. The next one, engagement, is purely for aesthetics and relaxation. So it certainly can be if an individual's goal is to build relaxation skills, build those coping skills. That may be something that we may be focusing on, but it's certainly not the only component. Sometimes the therapy needs to be not relaxing. Sometimes we may be working through a lot of different challenges, and it might not be relaxing. It might be stimulating. It might be challenging. And then the other component, purely for aesthetics, again, certainly the pieces or the artwork that comes out of this session may be, very nice to look at, but it doesn't need to be, and that's not really the focus or the expectation. Art therapy is intended only for young children or those with intellectual disabilities. So art therapy definitely is appropriate for young children and also for individuals with intellectual disabilities, but this isn't the entirety of individuals that come to work with an art therapist. Like I said, individuals that are, as young as 3 and, through older adults can come and gain benefit. Certainly individuals with the range of intellectual functioning, can find benefit as well. So again, this is just a misconception that unfortunately exists. So expression in sessions will always be beautiful. So sometimes the artwork that comes out of the session may be really not, great to look at, or, it might not be something, the individual even wants to look at. And that's okay, that's part of the process. I include this one too because I think one of the common responses from caregivers when an individual comes out of a session, they may say, oh, like that looks so wonderful, or that looks so great. And I think that's meant to be, of course, encouraging and really trying to connect with what just took place. But at the same time, sometimes it might not be, and that's okay too. And that might be one of our goals is, even just tolerating when we have outcomes that don't turn out the way that we've expected or don't turn out as we're hoping. Children attending art therapy will be having fun. So certainly I hope that some aspects are enjoyable, but I think setting it up that way for the child, that it's going to always be fun or that the goal is to have fun, sometimes that can be misleading and actually lead to some challenges within the therapy itself. So sometimes we might be doing things that are fun, but sometimes we might be also doing hard work, or we might be doing things that require energy and engagement. The patient's artwork is analyzed and interpreted by the art therapist. So again, certainly we have different things that we're looking for and different aspects we may ask questions about, but I'm always more interested in what the patient's meaning making is of the artwork than anything that I might be projecting onto it. And then the last point, research is minimal. So certainly there is a wide variety of research on art therapy, not only for autism, but also for a number of different other disorders and challenges. The American Art Therapy Association does have a really great section that they've done some really nice work of sort of separating out all the what they consider the relevant research to date into different categories. So I definitely encourage anyone who's interested to explore their website a little bit. They have some really great materials. And also you can, of course, just look for yourself. If you have a particular area that you're interested to see what's out there, there's definitely a lot. So, and if anyone has any particular questions about that or any interest in that, you can certainly reach out to me directly, and I can help guide you to where you may be looking. Okay, so I'm just going to talk briefly about the services that we do offer at CNNH NeuroHealth. So in addition to the creative arts therapies, I mentioned we also have behavior therapy, applied behavior analysis. We also have, of course, neurology and neuropsychology services. So we do have a full team of neurologists as well as developmental pediatricians. We have a lot of very unique testing opportunities. So we do have an HD EEG, which is for those that are familiar with the traditional EEG, the HD EEG is a much less invasive form. It requires a significantly fewer number of in terms of the contact on the scalp, it's much less invasive, and it yields a much rich data. So there's a lot more information the neurologist can take from it, and for the patient who's going through that process, it's a much easier process and less anxiety provoking. Through the neuropsychology department, they of course offer their psychological testing. They also do reevaluations, so for individuals that are seeking that's available. We also have a neurogenomics program where they do genetic testing. So I know a lot of our families have found that very helpful in terms of if medications are in question, what medications an individual may be responsive to or may possibly gain benefit from based on their genetic profile. We also have at any given time a large number of clinical trials going on. So you can certainly check out our website for more information on that. We provide all of the creative arts therapies currently at our Voorhees, New Jersey location, so the closest one to here. But we also have offices in Wall Township, New Jersey, and also King of Prussia, PI. And we do offer the neurology and neuropsychology services at those locations. So where to begin? So if you're looking for creative arts therapies, certainly the easiest way would be to submit an appointment request on our website. For all the creative arts therapies, art therapy included, we do schedule what we call an initial intake session. So it's a 45-minute visit where the individual meets one-on-one with the therapist. And if it's within art therapy, we're likely going to be using some of those drawing assessments. We may utilize other assessments as part of that process. And we're really assessing those clinical needs as well as potential treatment goal areas. And of course, the therapeutic fit. You want to feel comfortable with your therapist and feel like that's a good fit for you. It also allows the individual to have an introduction to the setting and the therapist. It allows the caregiver, if applicable, to ask questions and review the patient history with the therapist, and then also, of course, become familiar with the setting as well. So I often introduce it, especially to young children, as a getting to know you time. So again, we might show them the space of the room, explain what types of things we may be doing, but it's really just a getting to know you time. As I mentioned before, we offer a variety of different formats for the creative arts therapies, art therapy included. So we offer the individual sessions, which would be the individual one-on-one with the therapist. We also offer something called a dyad. So for individuals that maybe need a social opportunity or social setting, but the traditional group settings may be too large, overwhelming, or just not a good fit for their needs, we offer that. So the dyad is 2 participants with the therapist together. And then for our group therapies, typically it's a minimum of 3 participants, usually no more than 7 to 8 participants total. And each of the group therapies are really structured in terms of not only the age and developmental level, but also the clinical need. So for example, I have a group right now that's running for ages 10 to 13 children with anxiety and autism. The therapy may be structured in 30, 45, or 60-minute sessions, so we do have a lot of flexibility, again, to tailor to those individual needs. So for example, if we have a patient who maybe needs to start with a 30-minute session and one of their goals is building up tolerance to a 45-minute session, if it's just too much stimulation or too much exposure, to the different media, we can do that. Or the 30 minutes may be sufficient for an individual's treatment plan. We also offer a variety of different workshops for caregivers, teachers, professionals, and businesses. One of the most common areas that we get asked about, I think, is just kind of a buzzword right now, is this idea of self-care. So for professionals, educators, individuals that maybe have very high demand jobs or very challenging jobs, we do offer self-care workshops where we explore not only through the arts but through a variety of different other tools how we can really take care of ourselves as the professionals. And so we do offer that as well. So I wanted to include just some resources for learning. So I mentioned some of these websites before. The Art Therapy Credentials Board and American Art Therapy Association are certainly two great resources. There's also something called the National Coalition of Creative Arts Therapies Associations. So this is a coalition that really covers the full range that I mentioned at the beginning of the presentation of all the different types of creative arts therapies that you might encounter. Of course, Autism Speaks and parents of autistic children are other two great resources. Autism Speaks also has a really, really great number of different tools for parents and caregivers who are maybe navigating either an initial diagnosis or going through different transition periods with their child with autism. So that's another great tool that I always like to highlight. And there's also a number of other different groups that if anyone's interested, I can make available to you as well. Okay, so I think I'm going to leave a little time for question and answer. I did include my contact information on this slide, but I do also have cards up here, so if you don't want to write it down, you can feel free to take a card. So I'll open it up to questions.